This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson and Dr. Mike Apley here from Kansas State University's College of Veterinary Medicine. And Dr. Apley is a professor in clinical pharmacology, and we're talking about antibiotics. And Mike, we talked about static versus cidal antibiotics. We've talked about concentration-dependent versus duration-dependent antibiotics. So really two important decisions that veterinarians have to make when they're helping make the decision on which drugs to use. But you know, some of the things, oral versus injectable and spectrum of activity, are two things I have circled that you know, just walk me through a little bit on the difference between the oral versus injectable.
Yeah, a great example there, the tetracyclines. So everyone listening who works with cattle or hogs understands there's injectable and there's oral versions. And in cattle, if you look at the dose for a long-acting oxytetracycline injection, it's 9 milligrams per pound. Some have 13.5 milligrams per pound that's given once. Then you look at the oral feed administration form, and it's 10 milligrams per pound per day. And you go, wow, well, so they're the same. Well, they're not, because the oral bioavailability of the tetracyclines is really very low. So given 10 milligrams per pound per day in the feed is nowhere near reaching the same concentrations in the animal as given 9 milligrams per pound once that goes over 3 days, or the 13.5, which goes a little longer, because the concentration in their blood from the oral at roughly the same dose is about 1/6 to 1/8 the concentration that would be obtained by injecting it. So it's not the same. It's very different. So now, especially as veterinarians are going to be required to authorize that feed use, rather as now it being over the counter, that's one of the considerations the veterinarian is going to make is, okay, is it appropriate to use this, which is going to result in much lower systemic concentrations, or do we need to inject with another tetracycline? So the oral is the same dose given orally isn't necessarily the same drug reaching the animal as given systemically.
And with some of the oral products too. I mean, I use the oral products quite a bit, but you know, sick animals don't eat.
Right.
And so that's the other consideration, and now you're working with animal behavior and so many other things. And a lot of times, if I know that the calf is on the end of the needle,
yeah,
I know they got it, but I got to catch them too.
Well, and don't take us wrong, as in saying that oral tetracyclines aren't effective for some diseases, and especially controlling clinical anaplasmosis. Those out there have herds with anaplasmosis challenges starting in August through probably a month after vector season. We're going to have to do something to control clinical disease, and very low doses of that oral tetracycline is just enough to keep that anaplasma organism from running off and being really harmful to cows and bulls.
Well, thanks for being on the show today.
Thank you.
It's always great to have Dr. Apley here. Remember, work with your local veterinarian to develop your antimicrobial stewardship program and your program for your herd and treatment. If you want to know more about what we do here at K-State, you can find us on the web at www.vet.ksu.edu. I'm Dr. Dan Thompson. You've been watching Doc Talk today. Thank you very much for joining us, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. Doc Talk was brought to you by Merck Animal Health, the science of healthier animals.